Good afternoon, I'm Dr. Duke Machen. We're here to fix someone's back. We're in the operating room at Duke Spine Institute. Our patient has 3 discs that are causing back pain and a facet joint. We're going to be fixing the disc first, and then we'll go on to the facet joint. Unfortunately, some patients don't really listen and lay still. You got to lay still, lay down. Did you want him lifting his torso up?
We're trying to get the onboard back up. The onboard.
Is he uncomfortable with your onboard? All right. What just touched me? You just touched me. You did. Damn it. All right. Well, there are 30 things that cause back pain. So let's show our audience those 30 things. I'm Dr. R. Duke Machen with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, touches the vertebral bodies. With trauma, can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. And welcome back. Our patient is snoozing nicely. We just got access to L4-5. Now we're going to do L3-4, right? Everybody, 3-4. So I'm going to make a 7mm incision. The entire surgery is done with a 7mm incision. That's the size of a 1/4 inch and almost no bleeding. We don't do any damage to any of the tissues underneath the skin. Everything is done with needles and minimally invasive. Now, as opposed to open surgery, that's highly invasive and destructive, like laminectomy. He had a laminectomy. You see the scar right here? That white line is the scar. Folks, stay away from laminectomies. AP, extremely dangerous and unnecessary. Shot. All right, looking good. Shot. You're doing great. Just lay still. We're almost done. Our patient is quasi-awake. What that means is, shot, he's in and out of consciousness as we place the needles, which is the perfect state of being for him. Shot. Now, how many years of back pain has he had? 25 years of back pain. 25 years. Give me a marker. 25 years of back pain. Lower back pain, 25 years. Okay, suffering. And nobody ever fixed him or helped him. And he came to Duke Spine Institute, and we're going to get rid of that pain today. I determined that this pain is coming from primarily his 3 discs, most common cause, and then secondarily from the facet joint at L5S1. Sean, put some pressure there. So I'm trying to get into the 3 discs right now, Sean, and the hardest one is always going to be the bottom disc, L5S1. Sean? That's what I'm working on, because there's the most arthritis and the narrowest passage down there. The passage is extremely narrow, almost impossible. As a matter of fact, most spine surgeons won't even try. AP? I'm probably the only one in the world that does L5S1 transforaminal routinely and successfully. Oh yeah, that's nice. We're right there. Great job, Jordan. Great job, Jordan. Let's give a hand to Jordan today. Thank you. Thank you. Jordan, you didn't put the large gown in the extra large bin, did you? Sure. You don't expect me to believe that, do you? I know exactly who it was. It was the Italian stallion from New York or New Jersey. Where are you from, Nikki? All right. So at L5S1, I'm just at the back of the disc. I don't know if I'm going to be able to get in without the pay. Oh, that might have been it right there. Let's see, Sean. Yeah, that might have been it. Oh, that was it. We're in. Literally, I'm going to tell you, the space I just got into is about 0.5 millimeter wide. And that's the only way to get in, is 0.5 millimeter. So the tip of the needle is very pointy, and I slid it in, and I could feel it compressing around the shaft. We're there. We're going to do our discogram.
Okay? You all right? All right, don't move your head now. Don't move. He's awake.
Okay, when I asked him, where is your back pain, he told me it's here. And the three things that are here are 3 discs, L34, L45, L5S1. Clearly he had a laminectomy already. That was years ago, but it didn't work. It didn't fix his back pain. Are you comfortable?
How are you doing, my friend? Hello.
All right. Any questions?
Yes, we got a question coming from Ping on Facebook.
Well, Ping, welcome back. Hold on one second before I take this question.
Of course.
You think we should wait a minute, or are we good? All right. How bad is that on a scale of 1 to 10?
Give us a number. What number?
10. I heard 10.
10.
How about now?
Give us a number. 1 to 10.
What's the highest?
As you pain right now.
10. Is that where you get your back pain? All right. We don't need a narrative. So we got 10 out of 10 at L45, 10 out of 10 at L34, and it's concordant. Is that better?
Is that better now?
Good. All right. How bad is that? You can see his body tensing up. What's the highest it goes? 10? All right. All 3 discs are 10 out of 10. Is that where you get your back pain? All right. Thank you. That's good enough. So 10 out of 10. Folks, what are we doing here? We're doing a test called the discogram. It's the only test in the world that tells you for sure that a disc is the cause of somebody's back pain. You see, back pain has 30 different causes. We just showed you that video a few minutes ago, right, Henry?
Yes, we did.
And of the 30 causes, the most common is disc pain. We call it discogenic back pain. And it's coming from a tear in the back of the disc. That's what I discovered. I was the first person in the world to discover the tear in the back of the disc is the source of back pain. And because I discovered that, I realized there's a way to fix it. We go back with the laser and we clean up that tear. Jordan, I need a picture. Nothing? So by taking this laser and applying it to the tear, I'm able to go in and clean out the tear and get rid of the patient's back pain. Okay? And it's all done arthroscopically. Shot? All right, lay still. He's feeling. You want me to wait a little bit, or you think we're okay? Huh? Wait? I'll wait. Any questions from the audience? We're going to wait till he's a little deeper.
Yes, we have a question coming from Ping on Facebook saying, "Afternoon, Doc.
Afternoon, Ping.
I recently slept and woke up injured. My neck has been stiffer for a couple of months now, and crackling in my neck, which I used to do multiple times daily, now is more uncomfortable and often does not crack, but it feels like it's causing inflammation. Is this a bad sign? Thank you."
Yeah, the cracking and pain in the neck is coming from your facet joints, and you need the Duke plasma rhizotomy of your cervical facets. What you really need is to do another telemedicine with me, figure out what it is, and let's get it fixed. But something you all should understand. The pain you have in your back and neck is not going to go away on its own. It will get better temporarily. You might think it's going away, but it's not. It will be back until we fix it. So my advice to you is fix it now rather than living in pain, suffering, and more importantly, avoiding the activities that you feel bring on your pain because you don't want to bring on the pain. So your life is being limited. Your life sucks. Get it fixed. Stop procrastinating. Spend the money. Come and get it done right. That's my advice to people who are suffering with pain or the fear of having pain. Come to Duke Spine, get it done right. These people did. They're no different than you. They're just maybe a little smarter. All right. We are inside the disc at L45, correct, Luis? Yes, sir. On the patient's right side. Now, why did I choose to go on the right side for 2 discs, left side for 1? The answer has everything to do with leg symptoms. If the patient's having leg symptoms on the right leg, I'm going to go on the right side because that means the herniation is interfering with the function of the nerve root. The nerve root interference does not cause back pain, it only causes leg symptoms. So in this patient's case, his symptoms of back pain were sort of in the middle, but the leg symptoms were on both sides, mostly on the right, but he was developing left-sided symptoms as well. And as a result, I told him, you've got to have your left L5S1 fixed. So he agreed. He agreed to get it done. But he was originally just going to do the right side. But he's traveled far away. He's come from Ohio. I don't want to say where in Ohio, but Ohio. And he's here with his lovely wife. But he didn't want to come here, get his back operated on, and then go home and still have problems. So we talked yesterday about adding on the extra disc plus the facet, and which I discovered during the examination, and he agreed. So here we are doing it all, and hopefully he's going to be pain-free within a few weeks, maybe even by tomorrow. Any questions?
Yes, we have a question coming from Lanu on YouTube.
Lanu.
Asking, can the pain nerves be seen on the MRI?
No, you can't see pain nerves on the MRI. Nope, not possible. There's the inflammatory tissue, everybody. Look at that. Ariana, you seeing that? Okay, that's the tear, and you see the red stuff? That's inflammation. That's where his back pain comes from. It is the most perfect picture of inflammation inside the tear that I've been talking about for 20 years. I just shut off the irrigation. You guys see that?
Yes, we do.
Absolutely perfect. That is where the back pain comes from. And I discovered that at Duke Spine here 19 years ago, and I've been doing laser on it ever since, and we've been curing people's back pain ever since. Unfortunately, my colleagues don't listen. They don't care about this treatment. They want to do fusions and artificial discs and pain management. Why? Because it's more profitable. More profitable for them. Not good for patients, but good for the surgeon and the doctors. It's unfortunate, but medicine is evolved kind of like the iPhone, right? What does Apple do? Apple, iPhone, they sell you an iPhone, and then 6 months later they make another model, and they want you to buy that one too. And they want to keep changing a little bit and keep you buying their products. They never build an iPhone that lasts for 10 years, okay? There's always going to have to be software updates and hardware updates and new chargers and new charging cable and new devices that you have to buy. They want to keep milking you for money. And unfortunately, medicine has turned out to be the same way, which is why we call it the spine scam. Because doctors and implant companies, medical device companies, hospitals, they're all scamming these patients out of their health, out of their quality of life, and out of their money. All right. So far, everything's going well. You can see we've already removed that pink tissue with the laser, that inflammatory tissue. Any other questions?
At this moment, no current questions. So in the meantime, why don't we show the audience of how it is a herniated disc causes back pain and how it is that we cure it.
Henry, you're the man. I love it. That
Yes, we
right
do.
on the tear, exactly as I've told you for years and years. That is the cause of his back pain right there. Thank God he found us and came here. He wasn't going to be able to tolerate this pain much longer.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922. Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Well, you've seen from our animation here that the laser is used to clean out the inflammatory tissue that's in the annular tear in the back of the disc, called the posterior annular tear. We're not just removing inflammatory tissue, we're removing herniated disc that's stuck in the tear, causing the inflammation to occur. So the inflammation is actually your body trying to get rid of the herniation by bringing in the inflammatory cells that destroy tissue and cause pain and swelling and redness. And that's exactly what's happening, okay? Any questions? Grabber?
At this moment, no current questions.
So we're doing an annular debridement at L45 right now. This is the last of it right there. Man, that's just one big juicy, like sausage of inflammation right there. Look at that. Nobody had discovered this until I discovered this. Amazing. Just amazing.
We just got a question.
So simple, you know? If only somebody else paid attention years ago, they would have discovered this. Yes, I'll take the question.
Coming from Faisal on Facebook.
My friend Faisal.
Asking,
Yes, Faisal.
Doctor, talk to use about the sunovertebral nerves, and are those nerves that are causing the pain in the discs? Thank you.
So Faisal, the sinovertebral nerve is the nerve that is responsible for pain coming from the disc, which is exactly what this patient has, disc pain. So yes, the sinovertebral nerves come out of the neural foramen next to the dorsal root ganglion. They branch off, and then they wrap around to the disc, the posterior annulus. The sinovertebral nerves are somatic afferent nerves, so they carry painful, very highly localized painful signals from the disc to the brain. So your brain knows exactly where the pain is. That's the problem. These are branches of the sinovertebral nerve that are responsible for disc pain, and we're here vaporizing them with the laser. But these are not normal branches of the sinovertebral nerve. They're abnormal. They shouldn't be here. They're overgrown, like the roots of a tree just overgrowing in a pot. There's too many of them. They're not supposed to be here. But what brings them here is inflammation, chronic inflammation. You see, inflammation isn't just cells, it's also chemical mediators like cytokines. And cytokines, biochemically active substances that promote the ingrowth of new nerve fibers and blood vessels. That's why you have the red color from all the blood vessels that are new, and you have the pain from the nerve fibers that are there, that are new. Great question. All right, we're just about done. I'm going to try to pull out this last bit of herniation here. Any other questions?
This moment, no current questions.
All right, we're going to move on to the next disc, which is the L34. And the last one will be the L5S1. Lasers off, correct? Good job. We have a new laser technician in the house today. Let's welcome Ariana. Everybody, let's welcome Ariana. I want a round of applause. There we go. All right. So, our team is getting bigger and better. Hold on. Let's just see what there is. Man, there's just a little bit left right there. I'm going to zap that and we'll be done. Any questions?
At this moment, no current questions.
All right. So you guys know I'm gone next week, right? Patient's doing very well. Dr. Berndes informed me that he was very difficult anesthesia-wise because we don't know why, but he's been in pain for many, many years, so pain changes people's psychological makeup. They become more anxious, less tolerant. Over time, pain becomes more burdensome and begins to change their personality. So get your back fixed, your neck fixed before that happens. All right, we're done. I'm going to just grab out the last few morsels. Whoa, whoa, whoa. We're done doesn't mean you get to turn it off. Wait till I take the scope out. All right. Here you go. Now, yeah, you can turn it off. Thank you. I'm going to put some antibiotics. Just clean things out a little bit. Any questions, Henry?
Yes, we have a few questions. Next one is coming from Faisal, once more on Facebook.
Sure. Why not?
Asking, Doctor, thank you for that. I'm pretty sure that the sinovertebral nerves won't show on an MRI, just compression of the spinal cord or nerves or nerve roots going down the arm. Hence why some doctors will miss or don't know why the patient is getting pain.
Yeah, you're right, Faisal. Sinovertebral nerves, nobody really thinks about them or cares about them in the medical field. Doctors don't really care about them or take them serious. You've got to remember, Duke Spine Institute is leading the charge in curing pain. So we believe pain can be cured now from the spine. We know it can be cured because we do it all the time. Our patients are cured of pain. But other doctors' patients are not cured of pain. The patients stay in pain. So the other doctors believe that pain is incurable, that it's just manageable. And the way they manage the pain is by giving pills or shots or treatments that aren't going to work but may give a little bit of relief temporarily. So to those doctors, it's acceptable to treat pain but not fix it. At Duke Spine, we're beyond that. We realized pain could be cured 20 years ago. So we started curing pain 20 years ago. We stopped thinking of pain as being something that is not curable. We now know it is curable. It's just you have to have the right diagnosis and the right treatment to cure it. So it turns out that the sinovertebral nerve is important to curing back pain. But if you're a doctor who doesn't believe it's curable, back pain or neck pain, then you don't care about the sinovertebral nerve because it's not part of your daily treatments. That makes sense. Sean? Why does it look like that, Jordy? Huh? Go ahead and pull that out.
Yeah.
Sean? Let me know when I can proceed. All right. Shot? Any other questions?
Yes, this next question is coming from Brian on YouTube.
By the way, look at that x-ray picture before we take Brian's question. You guys see the tip of the dilator? I'm going into the tear. You guys see the tear? The black tear? I am entering the disc in the tear. Therefore, I'm not causing damage. I'm going through an area that's already damaged. So people ask me, aren't you causing damage when you go in? The answer is no, we're not. We're just going in an area that's already damaged. But I'll take Brian's question.
Brian asks, can Dr. Duke expand on his discussion about the nerves in the disc and why procedures like Intercept don't work?
It's coming out. Hold on. Shot? Well, yeah, before I answer that question, I want to say this guy's disc is so inflamed and painful that it literally pushed the dilator back out that I hit in. I nailed it in and then it pushed it out because it's under so much pressure. Kind of like a pimple is under so much pressure, it's pushing your skin up. This thing just pushed the metal out. I've seen that happen before. Actually, it happens quite a bit when people have really inflamed discs. All right, sorry, I'll take Brian's question.
Brian asks, can Dr. Duke expand on his discussion about the nerves in the disc and why procedures like Intercept don't work?
Yeah, Intercept is a procedure where they're burning the nerves in the bone. The bone is not the cause of your pain. The Intercept procedure is a perfect example of a greed and corruption in healthcare. Okay, greed and corruption. Let me explain how it works. Wall Street investors want to invest in companies that are going to make them huge returns of profit. So they want to invest a few $1 million and get tens of millions of dollars back. Medicine can offer that opportunity. If you invest in a technology at the very beginning and you buy it cheap and then lots of patients need it or get it, then you can make a ton of money, especially if that technology is cheap to manufacture. The Intercept procedure, equipment, device is very cheap. It's very inexpensive. Probably costs $50 or less to make. And then they sell it for tens of thousands of dollars. They're making huge profits and they're recommending it to lots and lots of, they have a huge distribution network, Boston Scientific, who owns the Intercept device. So they have all these pain management doctors that are happy to go put those things and burn nerves in people's bones. So the reason why it's even popular, even though it doesn't work, is because it's making tons of money for investors, for the device companies, and for the certain doctors that are performing the procedure, which are mostly pain management doctors. It's not making money and being done because it works. It doesn't work. Now, Boston Scientific, who owns the Intercept procedure, they just declared their Superion device to be recalled because of all the failures and bad results they've been getting. The Superion device is an interspinous device. So they literally just recalled the device because it's not working and it's falling apart in patients. That we just did a video on that this week. It's going to come out next week, right, Henry?
Correct.
Yeah, and it'll probably be on our podcast too. Point is, these big companies like Boston Scientific, they buy up technology at a cheap price for $100 million, and they turn around and they make billions of dollars selling it to hospitals and insurance companies and patients. But they have these doctors, these pain management doctors, that are eating out of their hand like little squirrels. And these pain management doctors recommend all these treatments to their patients because, well, the pain management doctors are going to get paid a lot of money to do those procedures like the Superion and the Intercept, even though they don't work. Now, here's the problem. The reason they're bad is because the doctors tell the patients, we don't have a way to cure your back pain. But there is a way to cure the back pain. It's the Duke laser disc repair. But they don't know how to do the Duke laser disc repair, and Boston Scientific's not going to make any money off me when I do Duke laser disc repair. So Boston Scientific doesn't want the pain management doctors recommending Duke laser disc repair, which is curative. Boston Scientific doesn't want the pain management doctors doing Duke laser disc repair. Boston wants their pain management doctors doing treatments that don't work, that give patients some temporary relief for a few weeks or a few months. But then the patient's off to the next treatment that Boston provides, like a stimulator. So it's basically a scheme where Boston provides all these treatments, like they're the manufacturer of the device, so they're making billions of dollars selling them. The doctors that put them in are making billions of dollars, and the patients are just receiving all these treatments that don't work. And in my opinion, the Intercept device is one of those treatments that doesn't work, because it's not targeting the true source of pain. That's all I'm going to say about it. It's garbage, but it represents the very crux of the problem in healthcare, besides the insurance companies scamming everybody out of their money and not paying for their medical care. Medical device manufacturers are at the heart of the corruption in healthcare, and doctors are along for the ride because they're making so much money doing these procedures that don't work. And they don't want them to work because they want you coming back for the next 20 years of your life, getting more and more shots and treatments and pills and devices put in your body, because that's how they make their money. Our procedures at Duke Spine don't put any devices in your body. We put nothing in. We just go in there temporarily, like we are now, and we clean up things and help your body heal itself in a natural fashion. Next question. Oh, look at that little herniation right there. You guys see that blue herniation that popped out?
Yes, we do.
Right out of the tear.
Next question coming from Faisal once more on Facebook, asking, Doctor, basivertebral nerve, BVN, is a nerve located within the vertebrae of the spine. Can that cause bone pain? Thank you.
Yeah, basivertebral nerve doesn't do anything. It never needs to be treated. The Intercept procedure, in my opinion, is a complete scam. It's stealing billions of dollars out of our healthcare system, and it is causing patients to have treatments that don't work. I have never yet met a single patient where the basivertebral nerve ablation worked. And I've had hundreds of patients with basivertebral nerve ablation. Not by me. I won't offer it because I know it doesn't work. It's just a scam.
Next question is coming from Mark on YouTube,
Hi, Mark.
asking, do you do C0 to C7 fusion to correct a scam/fraud ACDF C4 to C7 fusion? My translation BAI is 7 millimeter. I'm miserable. Opioids, PT, Lyrica, Buffett, scam surgeons, all
Yeah. Well, my friend, I hear you and I empathize with you. There is only one way to get well, and that is to do a telemedicine with me. We do it for free. We don't charge you the telemed fee. It's literally $1,000 value you're getting for free. And all you got to do is upload your latest MRI onto our website and set up a video conference with me, where I'm going to tell you exactly what's wrong. and how it can cure your pain. And it probably has nothing to do with fusing the rest of your spine. You probably don't need any more fusion. If I had to guess, I'd say I'm 95% sure you don't need any more fusion to get rid of your pain. All right, we'll take a break from the questions for a moment, and you can see the laser. This laser fiber is 1 millimeter, which is the space between your fingers, the smallest space you can make your fingers to see light. It's a millimeter, and it's releasing laser energy out of the tip. And that energy is being absorbed by the tissue, and then it breaks apart the tissue into small pieces, called fragmentation. Fragmentation or vaporization is another term. But there's another function of the laser, and that is to create what's called a cavitation wave, which, remember, you're looking at this thing through water. There's actually liquid water here, and it's sterile saline, and it's not air, it's water, and that's what helps cool the laser fiber. But it also allows, when the laser energy is released from the tip with each pulse, it creates a cavitation wave, which is like a very powerful sound wave, like a blasting sound wave. And that's what's shaking everything so violently. Okay? Now, as I release these pieces of herniation and get them out of here, they float up, right up through here, up the tube and out. But you can't see it because it's so fast. But if you could slow this film down 100 times, you'll see little pieces of herniation flying right past our camera. That's why what looks like solid tissue is becoming a hole. We're debriding the tear. Any other questions?
No current questions.
Thanks, Nikki. Oh shit, did I say that publicly?
I just said thanks, Nikki. That's all.
No, I know, I'm joking. I'm joking with Nikki. Nikki gets my joke. I'm busting her chops. All right, any questions?
At this moment, no current questions.
You guys see the white stuff here in the herniation? You know what that is? A lot of people get steroid injections, right, for back pain. That is the preservative from the injection. The doctor he saw stuck the steroid in his disc. Go back and look at it. Literally, the doctor stuck the needle into the disc and injected the, what is it, Depomedrol? Which one has the preservative, right? Depomedrol? The doctor injected the Depomedrol right into his disc. That's what we're seeing. It's literally an impurity found in the steroid. I don't know when they did that. They must have done it. Maybe they did it during his laminectomy. There's so many doctors out there scamming patients with treatments that don't last and don't work, like laminectomy, discectomy. All right, here's the end of the disc right there. You guys see that? At 12 o'clock. It's a lot of scar tissue here. That's why it doesn't look like a normal disc. How much energy have we delivered on this disc? It's not bad. We've had some discs where we put in 50 joules, right? About 2 minutes. 2 minutes on this disc. Then we're going to go to his facet on this side, and then we're going to go, right, Luis, or you want to do the other disc first? You want to do the other disc first? All right, fine. Other disc first, then the facet. Just one facet, right? Our next patient, folks, comes from California, and he's having 2 discs repaired. This patient was from Ohio. Next patient, California. Last patient was Canada, and the patient before was Chicago. No, Colorado. Sorry, Colorado. And the last one is South Carolina. All right, we are just about done. Another minute. I just want to get the lateral herniation here. Any questions?
At this moment, no current questions.
Well, then let's show the 30 causes of back pain one more time.
Of course.
Such a great. Oh, you know what you can show?
Oh,
Show the
I know
Duke laser disc repair versus other treatments.
Yep.
I know we're going to get the old, not appropriate for, what do you call it, advertisements? but
Age
oh well.
restriction. Yeah, it's
Who
okay.
cares?
It's fine. Not a problem.
Hi, I'm Dr. Duke Machen. We've just completed our free MRI review with Duke Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that is causing inflammation and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain. And that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically, people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Duke Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Duke laser disc repair. We've been performing the Duke laser disc repair since 2006 here at the Duke Spine Institute. To date, we've had 0 complications. The Duke laser disc repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Duke laser disc repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Duke laser disc repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Duke laser disc repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Duke laser disc repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding, and it heals within a few days. There is no need for narcotic painkillers. If you have the Duke laser disc repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Duke Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest, most effective outcome in the world that lasts a lifetime. Thank you for listening. We're talking about pickleball at the Duke Majan residence. So I had never played pickleball. Kids came back from college for summer. They asked me, my wife asked me, let's go play pickleball. I said, absolutely not. And then one night they said, let's go for a bike ride. I said, yeah, I like bike ride. So we rode the bikes and we stopped at the pickleball court. And they got off and I tried to get away and they grabbed my bike and they said, you're not leaving. You're going to play one game of pickleball. So I got out there and I played one game of pickleball and it was amazing. I really liked it. It was so much fun, you know? As long as you don't take it too seriously, it's fun. And I stayed for another 5 games. And there it is. That's my introduction to pickleball. Henry, how about you? When did you start playing pickleball?
My friend hooked me onto it, I would say late 2022. There was like a new pickleball court that was just open at like a few minutes outside his neighborhood. Drove there, we played it, and I'm like, oh, this was fun. And then I just got into that subculture, started watching like the events on YouTube here and there. I'm not like, it's not like a vital sport, like basketball or MMA, but it is really fun, and my friend hooked me onto that, and so.
All right, good.
Yeah.
Well, folks, this is left L5S1. When he came to Duke Spine, he didn't want to do this one. I told him he needed to have it done on our telemed, but he didn't want to do it. And then, lo and behold, he showed up and told me, I'm starting to get more pain in my left leg, and I have a feeling it's just going to get worse. I said, yeah, it's definitely going to get worse. You need this L5S1 disc done. All this shit I'm taking out right now, this is all scarred up disc material that's herniated and scar tissue combined, and it's literally crushing his nerve right here at L5S1 on the left. You could see it on the MRI. As a matter of fact, this L5S1 on the left is worse than the other two discs in terms of pinching the nerve. So it's sometimes very surprising. You can never just rely on the MRI. There's a big piece. If you just rely on the MRI, you're never going to make the right diagnosis. You must look at the patient. You must understand what the patient's telling you about their symptoms. And that's what I did. And I knew that this thing needed to be fixed. Here you go. Because it was going to rear its ugly head after surgery if he didn't get it fixed. So he chose to get it fixed, which was the right choice. Look at all these pieces of herniation coming out. But they were all sitting here like a sack of marbles, putting pressure on his nerve. All right. Once again, this patient had a prior discectomy, laminectomy, and the last patient had a prior laminectomy and fusion. Was the last one fusion? Yeah. Mm-hmm.
Last patient's doing great. Patient with fusion.
They can go home. Send them out. Any questions?
Yes, we have a question coming from Lanu once more on YouTube.
Hi, Lana. Sure.
Question for Henry, me, asking, do you work on gardens or flowers like Dr. Duke? That's actually a good question. At the moment, no, but eventually down the line, either later this year or sometime next year, I'm trying getting my own place, getting my own house and everything, and with the help of my parents. And I had the idea of putting flowers and just a garden around the front yard and everything. So I had that idea in mind. So yep.
But Henry, tell Lanu that maybe you're not gardening, but what are you doing? Didn't you add a new member to your family?
I did add a new member to my family. I have a beautiful 1-year-old French bulldog named Bonzo, and he is my son. I love him to death. He's the best. And yeah, that's where, when I go home, that's usually what I prioritize, is just taking care of him, relaxing, and yeah.
Is that right? Did you name the dog after the drummer of Led Zeppelin?
Who asked
Vern
that?
does.
You were the first person that got that right.
Wow.
Yeah. He's the
didn't
no
know
one
that.
asked that. Someone was like, "Oh, why'd you get that name?" First person to ask that. Thank you, Dr. Prentice. Correct. Yeah, John Bonham.
Wow. I didn't even know that.
Yeah, his nickname was Bonzo.
That tidbit of information. That's pretty cool.
Yeah. I'm a huge Led Zeppelin fan, so.
Yeah, me too.
Yeah, of course.
But I didn't know that about the drummer.
Yeah.
Man, Zeppelin's a little bit ahead of your time. But that's why your hair looks the way it does, right?
It's definitely one of the reasons. I grew up with rock music and just that kind of culture, and it's just resonated with me, and you can see it in my hair.
It's awesome.
Yeah.
Any other questions from our audience?
At this moment, no current questions. We do have a comment coming from Mark on YouTube once more,
Sure.
mentioning that they have sent their info with the Duke Spine MRI.
Good.
And they're looking forward to it.
Yeah, man, I'm looking forward to it, Mark. It's best to do it the right way, get the right opinion, find out what's really wrong. Otherwise, it's just guesswork. And that's the worst thing people like you want. You don't want guessing. You want to know what's really happening. And to get that, you need a diagnosis. And I can give you that. And I do it for free. I do it for free because I really want people to understand what's wrong. And more importantly, what can be done to fix it. Oh, cool. You'll meet Natalie. She's our MRI review person. Obviously, you'll meet me outside the OR. Any other questions?
At this moment, no current questions.
All right, so far we're making really good progress at L5S1 on the left. I've removed probably 50% of the herniation. I've got a little bit more to remove. You can see how difficult it is. By the way, for those of you who say, oh, why do you need laser? You know, other doctors don't use laser. You can't do this surgery without laser, period. You're not going to be able to get it done. It is impossible. You have to use a combination, laser and grabber. And the grabber has a name. It's called a pituitary rongeur. That's its technical name. Thanks. Pituitary rongeurs are used. Oh, there's a big piece of herniation right there. Pituitary rongeurs are used in neurosurgery mostly. They're named after a procedure that they were first used for, which is to remove a pituitary tumor. Now, pituitary tumors are tumors that grow at the base of your brain, right in the pituitary gland, obviously. The pituitary gland sits at the base of the brain in a bony structure called the sella turcica. The sella turcica, Faisal will like this, it stands for the Turkish saddle, and it's named after a type of saddle used by the Turks, the Ottomans. They used to have a saddle with a shape that sort of wraps around you and holds you in so you can't fall out while you're at war wielding a saber. Anyway, that said, the Turkish saddle or sella turcica is where the pituitary gland sits, and tumors of that gland sit at the base of the brain, very difficult area to get to. That's why neurosurgery is so challenging, is the access. Access means getting there. The surgeon's access is their corridor, surgical corridor, their entry and target and path along the way. So, yeah, anyway, the pituitary rongeur was originally designed and used to remove tumors of the pituitary gland. It's very long and skinny, so it could fit up your nose, which is how most pituitary surgeons take out pituitary gland tumors, through the nose. So it's got to be long and skinny, go right through the nose up to the base of your brain, where we reach in and grab out pieces of the tumor. So that's what this is originally designed for, but I use it for spine surgery because it's the best tool for this application. Any questions?
At this moment, no current questions.
All right. Just about done. I've got about 5 minutes maximum. And we're going to move from here straight on to our facet joint rhizotomy, Duke plasma rhizotomy. And then we're going to be done. Shot? Sorry. That's what I meant. I meant laser shot. Huh? What are you gabbing about? Any questions, Henry?
At this moment, no current questions.
Oh, I was just asking Henry if he had any questions. All right, just about done here, Jordan. Probably 2 minutes left. A lot of bone spur right there, zapping that away. This disc, by the way, is the worst of all. That's calcified herniation right there. It's just really, really, really difficult to get rid of this thing. It's just, I could see why his nerve was getting pinched so bad. It's a good thing he did this disc. Needed to be done, that's for sure. Any questions?
Yes, we have a question coming from Lanu once more on YouTube,
Yes, Lana.
asking, so many surgeries today. Are you folks tired or hungry?
Well, I do feed them, so we're not so much hungry. Dr. Berndes might be, because he hasn't taken a break yet to eat. I actually had a few slices of pizza, but yeah, all right. But as far as tired, my legs are a little tired. My mouth is getting there, right? Nikki's laughing at me. We're all done. I mean, yeah, but we got to do the rhizotomy. So we're done with the disc. We're going to move on to the facet. You're doing great, my friend. All done. With your third disc, we're going to put some antibiotics. You're doing great. Everything's going well. We're going to put you a little deeper. we're going to give you some anesthesia now. Berndes is not laughing. He's not happy with me. He's like, why are you waking my patient up? He's blaming me. Why are you waking my patient up? Right? Hey, surgeon, don't wake my patient up. Whoops. You better watch out a little bit there. I love it when the anesthesiologist blames the surgeon for lack of anesthesia. All right, went well. That was honestly, I shouldn't have been able to do that, but I was able to do it. I have a lot of experience doing L5S1 transforaminal. Literally, I'm not bragging. I have no interest in bragging, but I'm just telling you, other neurosurgeons that do endoscopic surgery never do transforaminal 5-1. And this was a hard case. They won't even do easy ones. All right, we're done with the disc. Bring the fluoro in. We're going to fix the facet joint on the right side at 5-1 because he has facet pain. No. 3 discs and a facet. Going to get this done as part of the surgery.
Copy that.
Okay.
Perfect.
So it's right, 5-1. Everyone agrees? Shot? Shot? All right, Jordan, you see the TP at 5? I think I see it right there, yeah. All right, so I think probably right there. Shot? That's probably the best place to go, right there, right in the middle. All right, so stay with us, folks. We're almost done. We're actually doing his facet treatment right now at L5S1 on the right side. Shot. Now my target is going to be the top of the facet. Oh, sorry, the top of the TP. Shot. What do you think about that, Jordan? You think that's a little too low, or you think that's good? That looks pretty good to me, right? It's kind of the bottom of the TP. Would you agree? Yeah? All right. Perfect. I can feel it. It went really well. All right. We're going to do down below. Hold on. Shot. Let's see where we are. All right. So our target now here is going to be lateral and inferior. Shot. Yeah, pretty much right where my tip is. You guys see that? That's
Yes,
the
we do.
exact spot right there. Shot.
We have a question.
Yep. Hold on. Shot. 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 No. Shot. shot. And not an easy one to get to the facet. All right, that should be it.
Studio note, please.
Well, I think everything went very well for him. He's had very bad stenosis on the right side and left side with pinched nerves. He's had prior back surgery with laminectomy, discectomy, and his nerves were getting pinched very bad. We just unpinched them endoscopically. So I expect the leg symptoms to go away. It's going to take some time, but it will go away. And his back pain should be going away or gone. You can see how small the incisions are. Thanks for joining us. Any questions?
Yes, we just have about 2 questions. First one is coming from Lord Impaler on YouTube,
Hi, welcome.
saying, all right, so I have a question. I have C5, 6, and 7 that I'm looking to do the laser surgery on, and I have a little bit of degeneration from surgery last year for my L4 to L5 with stem cells. Would that work?
It should work, but you got to do our telemedicine, our virtual consultation. I've got to know exactly what needs to be fixed. So I've got to look at your imaging, examine you, and I'll tell you exactly what needs to be done. But we don't need to do any stem cells. They don't work, not for the spine.
And then lastly, from Mark, once more on YouTube, asking, if L5 to S1 discectomy and laminectomy failed, can your surgery resolve foot drop?
Yes, it can. The only way that my surgery will not resolve foot drop is if the surgeon before cut your nerve or crushed it badly, or you had too much nerve damage before and the nerve is already beyond, fixing. But I should be able to tell you that when I look at your films.
As of now, no current questions.
All right, let's show them one of our patients who had surgery with us, and we'll see you guys shortly for the next case. I'm Dr. Duke Machen, CEO and founder of the Duke Spine Institute. I have a patient with me who just had the Duke laser disc repair less than 24 hours ago, about 12 hours ago. And here you are. How do you feel today?
I feel better than I have in probably half a year. I'd say close to 5 or 6 months. It's one day after, and time will tell, but I didn't think this was possible this quickly.
Yeah, time will tell. We've done now 2,200 of these surgeries with the laser endoscopic. Consistently, the pain is gone. It's permanently gone. It never comes back. And so I'm excited for you that you're gonna do fantastic. Now, you live about an hour away. How did you find out about Duke Spine Institute?
I got a referral and noticed that it was only an hour away, so made my way up here, and the first time I came for a visit was kind of felt like home, kind of felt like where I should be anyway, so that kind of fit right into everything this far. So
You had, was it back and leg pain, correct?
back pain a little bit, but my biggest issue was shooting down the leg pain. It was numb all the time for about 4 or 5 months on and off, so didn't know what else to do, and this was the right choice, I would say.
You came to us and we found weakness also. You had weak pulling your toe up. That's because the nerve was pinched so bad at L5S1. You can see here on the video, we went in with a tiny Band-Aid incision, 1/4 inch. We went in and basically removed most of the herniation, cleaned up the tear where it came out of so that the tear will now heal. Your disc will heal naturally. And we did it all without removing bones or ligaments. If you had had a microdiscectomy or laminectomy, which is what every other surgeon offers, because they don't know how to do the endoscopic surgery, it's a newer technology, then you would have had a bigger incision, you'd be in a lot more pain today, and you'd have bone and ligaments taken out of your back. It would weaken your spine, which would set you up for fusion. But with our surgery, there is no need for any future treatment on the disc. It's permanently fixed. Now, are you taking any pain meds today?
I haven't yet today, and I haven't felt the need to, which was another surprise I had too.
Yeah,
So
no pain meds, right?
Nothing.
No bleeding, no hospital, no pain meds.
Nope, in and out pretty quick. It worked out pretty well.
Pretty happy?
I am.
And you were referred through Coral, right?
Correct,
Coral
correct.
Network.
Coral Network.
What do you have to say to the Coral people who approved your surgery?
I just appreciate the approval and the opportunity to live like normal and be a normal human again.
Yeah, Coral did you well. I guess they somehow got you to us and you avoided having an invasive surgery that was going to hurt you more than help you.
Correct.
Congratulations.
Yeah, well, thank you, Doc.
Anything else you want to say to your fans out there in YouTube land?
I would just encourage you to look into Duke Spinal and figure it out if that's the right fit for you, and it was for me, absolutely. So thank you.
You're welcome, my friend.
Appreciate it.
Congratulations.
Take care. You too.